Ladies and gentlemen, thank you for staying with us during the entire day. We've had a very busy day today, and we've covered many topics. Our primary focus of our policy summit was to really take a good hard look at where we are now with the President's executive order of advancing American Kidney Health Initiative. I think we can all agree that we've made much progress, but we still have a ways to go. Earlier today, during the introduction, I issued a number of challenges that we face. And I want to emphasize that many of those challenges can be addressed as we implement the executive order. So we're looking forward to having your support as we pursue that particular objective. We also talked about particular barriers to innovation and greater patient choice. Greater innovation means greater patient choice, and we had a very insightful discussion on that particular topic. And again, as a policy summit, this is an area where our national partners, whether they be on the federal agencies, whether they be industry partners, and certainly with fellow organizations, we can all agree on and focus the fact that we need innovation. Sometimes as industries change, innovation can be stifled. That's where we need your support, because in many instances, it is easier to maintain the status quo than to implement innovation and new technologies. And we have a very simple principle. We want to do what's in the best interest of the patients. So that is something that we will continue to work with, and we certainly need your help in doing so. Then we address one of the important areas of key legislative issues that are currently ongoing in Congress. I happen to have moderated that panel. We asked some questions of our panelists, which they answered. And again, we are making progress. We still have a ways to go until we can address and actually accomplish and complete all of these legislative issues. We will continue to work hard, talking with congressmen, talking with senators, and talking with other stakeholders to see if we can get these things done that will certainly be of great benefit to the patient. And when we talk about benefits to the patient, we're talking about a benefit to society overall. Many of them are workplace issues, they're tax issues and things of that nature that will lead to a better quality of life for patients. So this is an important area that we need to continue to pursue. Then on the national scene, we talked about some of the innovations that are coming along nationally, and we think that the panel did a tremendous job there. Yes, this is a policy summit, but innovations are policies, are issues that always come up in a venue such as this, and I think the panelists did a great job in terms of addressing those particular areas. And in closing, a couple of things. Number one, all of you patients out there who are watching, I want to give a direct message to you. We need you. We need you to join us. We need your voice. We need more patient ambassadors. We need more of you to become involved and engaged. We need you to help educate other patients. We need for you to help us advocate all of those things. And the other thing I want to share with you, our organization, our mission is about education and advocacy. Now, you will see that at the bottom portion of your agenda, we have links to a number of webinars that we have been doing over the past several months. These webinars are addressing different aspects of COVID-19. They're addressing mental health issues. They're addressing dealing with COVID-19 upstream. They're addressing a number of issues that relate to patients as well as professional healthcare providers. So we want you to avail yourself of this library that we have made available to you so that you can begin to get a sense for all of the resources that our organization is making available to the patient population. I thank you very much for joining us today, and I'm going to turn it over to Paul Conway.
Thank you very much, Richard. Richard Knight's been a very good and loyal friend of mine for over 10 years. And together, we really did lay out the strategy and the tactics and the initiative that became the annual policy summit for the American Association of Kidney Patients. What I'd like to do is thank everybody who's been watching us today, and for all of our participants. We've had a very distinguished list of guests. And so what does the next year look like? Here's what AAKP is going to be doing. We work very closely with our allies across the kidney space. We're going to be watching to see how the executive order is implemented, and most importantly, how the principles that are included in it, principles like patient choice, and creating an environment and a policy structure for greater innovation to change the status quo in kidney care, unfold. We'll be watching that very closely. 2020 is an interesting year. What we've encouraged our patients to do for the past 2 years is to register to vote and to raise their voice and to be active participants in the policy process. Because the people that we elect determine policy, and policy determinations determine patient outcomes, and most importantly, they determine patient lives, especially for those who fight kidney disease every day. The patients that we serve and have had the honor to know, and the good friends that we have lost over the years, are patients who were brave, they had courage, and they saw themselves as vessels for change. They believed that their lives mattered, and that the lessons that they offered to researchers and to political officials and to innovators were important lessons, and they shouldn't be lost. We feel exactly the same way. We are patients, and someday we too will pass the torch. But what AAKP is committed to is this. Strong policy for patients means having a long view and having a strategy that engages not patients simply in the United States, but patients around the globe. Patients activated are strong contributors with innovators and policymakers, and our voice must be represented at the table. So here's the look ahead. We'll have a 4th annual policy meeting next year. Our patient meeting continues to be the largest patient meeting in the United States. And just less than a month ago, we had our 2nd annual Global Summit with George Washington University School of Medicine and Health Sciences and our good friend, Dr. Dominic Raj. We'll be growing each of these events, and we're growing them under the umbrella of Decade of the Kidney. And what is Decade of the Kidney? It's simply this. It looks at the executive order that was signed in 2019 as a first chapter in the next 10 years of history in kidney disease, which will be marked by far more greater patient choice, more innovation, more research, and more inclusive clinical trials to start not just to fight kidney disease, but to cure kidney diseases, and to get patients to the point where they're actively engaged in their societies with innovations like artificial implantable and wearable kidneys, earlier upstream detection, and solutions that actually solve problems for patients and their caregivers so that they don't drop out, they don't become disaffected, and they don't become reliant upon society for things that they would rather do on their own, which is pursue their aspirations and live a strong life. It's what we all aspire to. But at the end of the day, it comes down to decisions that are made, not just in Washington, D.C., but around the world, to fund the resources that are needed for research, to back innovation, and to create an environment where those who have the courage and the means to pursue innovation in medical technologies that help people and save lives can do so without penalty and without discouragement. That's what our policy summit is about. That's what we're focused on for the coming year, and we ask anyone that's watching this to please engage with us. The American Association of Kidney Patients has no membership fee, not for patients. We're fully inclusive, we're a strong voice, we're now the largest independent kidney patient organization in the United States, and we're growing rapidly. Please join us, please follow us, and again, thank you to our sponsors and for all of the guests who joined us today. Thank you.